Hi there, this is Marva Riley. I hope you're having an amazing afternoon. I want to talk a little bit about a couple things I want to discuss with you. I want to put a disclaimer that I'm not a physician, I'm not a doctor. I'm a registered nurse, author, and holistic health advocate. I'm always researching. I've been a registered nurse for over 24 years. So I do know quite a bit. And most of my experience has been in the area of critical care. And also, I have had many bouts of health problems over the years and have been able to reverse them. So I do know quite a bit. So I want to put a little bit of disclaimer out there. I want to talk a little bit about diabetes, kidney disease, anemia, overweight, cholesterol, lack of sleep, vitamin D deficiency, and how all of that are interconnected. Okay, I have a viewer who asked me to kind of touch on these topics, and that's exactly what I want to do this afternoon, because guess what? Knowledge is power. And when you get the knowledge and you practice what you learn, you usually will have success. All right, so here we go. Anemia is linked to diabetes, and kidney disease is linked to diabetes. So if one is diabetic and your blood sugar is uncontrolled, you're not eating properly, you're overweight, you're not exercising, you're not sleeping, so your A1C or your fasting glucose is high, and you're on diabetes drugs, including insulin and metformin and all that kind of stuff, you've been told by your doctor that you have diabetes. If it's uncontrolled, okay, if your sugar remains high, a lot of times or most times, what can potentially happen is that your kidneys, sorry about that, your kidneys will potentially be damaged. I mean, highly likely that eventually you will have kidney damage if your blood sugar remains high for a long time, years usually. So diabetes leading to kidney disease, and once you develop kidney disease, a common issue that I see with people who have kidney disease, they might not be on dialysis yet, but they have kidney damage due to diabetes, for example. A lot of those patients have anemia. Okay, so oftentimes the physician will put them on iron pills, or will put them on iron pills, and also tell them to eat iron-rich foods. Like for those folks that eat meat, they might say eat liver, eat beef, things like that, and green leafy vegetables, iron. I remember some years ago, I used to suffer with anemia, and I used to have heavy menstrual period, and I suffered with anemia. And my friend told me that I should drink blackstrap molasses every day mixed with water, and of course have vitamin C stuff with that, because when we eat vitamin C rich food along with iron, our body is able to absorb the iron better. Without vitamin C, the iron can't really be absorbed in our body. So that's important to know. But like I said, my patients who have diabetes, uncontrolled diabetes, your blood sugar is high all the time for perhaps years, they oftentimes developed kidney disease, and with the kidney disease comes the anemia. So that is why I think folks should not be focusing so much on keeping the blood sugar down, but rather getting to the cause. Why is my blood sugar high all the time? Is it because I'm not eating properly? Is it because I have too much weight on? Is it because I'm not exercising? Is it because I'm not sleeping? Because another thing is that so many of us are so busy doing all kinds of stuff that we don't sleep at night. But a lack of sleep, believe it or not, can raise your blood sugar. Anything that stresses the body can raise the blood sugar. So it's important to rest, it's important to relax and not overdo things, and set time, 7 hours for sleep at night, so that your cortisol level is not too high. And when your cortisol level is high, creates inflammation and also raises the blood sugar. So that's very important. Overweight and obesity are directly linked to high blood sugar, directly linked to diabetes, especially type 2 diabetes, which type 2 diabetes, when I went to nursing school, was called adult onset diabetes. So it's that diabetes that you generally see in adult life, and that's usually, oftentimes, because in adult life we pack the weight on and we keep that weight on, and that excess weight leads to high sugar, and that consistent high sugar leads to diabetes, and diabetes leads to kidney disease, and kidney disease leads to anemia. You see how everything is linked. So you got to address the underlying cause. I remember some years ago when my ex-husband used to have high cholesterol, high triglycerides, type 1 diabetes or insulin dependent diabetes, kidney disorder, liver disorder, and vitamin D deficiency. And I remember taking him to see a kidney specialist who was big on holistic care. And he told me, which I was a critical care nurse, but I didn't know all of that. And even regular physicians, a lot of times don't know these things. But he told me that if you show him a person who has diabetes, and he will show you that usually their cholesterol is going to be high. If not now, later on. Usually their vitamin D level is going to be low. Usually they're going to have anemia. They're going to have all of what I just mentioned. Okay. So his prescription was to address the underlying cause, which was the way he ate and the exercise. And he was actually able to get him off a lot of pills. Okay. Also, the thyroid also is linked to diabetes and high sugar. You see, that's why when we address health, we got to address it from a holistic standpoint. Not just pills, but our diet and exercise and sleep and stress and sunlight for the vitamin D. I remember also some years ago when I worked in critical care, there was an endocrinologist that he was a lead endocrinologist at the hospital that I used to work, and he did extensive study on vitamin D deficiency as it relates to thyroid disease and as it relates to diabetes. And he was one of the first physicians that I saw starting to put his patients on vitamin D3. Because before that, physicians were putting elderly people on just straight vitamin D. And they realized that the body was not able to absorb straight vitamin D. So this doctor started putting all his patients that had diabetes and thyroid problems, he would put them on vitamin D supplement. And standard protocol was to do a vitamin D level check. And that was years ago when physicians first started getting into vitamin D supplementation. So you see how everything is linked? It's important to get adequate sunlight. Most people in the United States, for sure, I'm sure Europe and other parts of the world where folks are not spending any time outdoors or very little time outdoors. Winter is half the year. If you do vitamin D test on these folks, 10 chances to 1, their vitamin D level is going to be low. Vitamin D is called the sunshine vitamin. So it is when we get outside and get exposed to sunlight that our body converts that sunlight to vitamin D. That's how we soak up vitamin D, as it were. Doesn't mean that we should go out in the sun and the heat of the day and burn ourselves like I see many people do on the beach. That's a setup for skin cancer. But certainly get outside in the mornings when the sun is not too hot, 9, 10 o'clock, maybe even 11. Get some sunlight. And in the afternoon, like 3, 4 o'clock, when it's not too hot, and get some vitamin D. So I think that's pretty much it. Anemia, diabetes, and kidney disease, they kind of go hand in hand, part and parcel, as my grandmother would say. And overweight and obesity, lack of exercise, insufficient sleep, all of that will drive up your blood sugar. High cholesterol is often connected with that too. And cholesterol is a lifestyle thing. If you eat properly, eat mostly vegetables and fruits, plant-based stuff, that will help to bring your cholesterol down. And by the way, eggs have a lot of cholesterol. Lack of sleep, like I said, can increase your blood sugar. And vitamin D deficiency is definitely related to diabetes. So it's very important to get sunlight. And many doctors, like I said before, are now putting their patients on vitamin D3. Cholecalciferol is that form of vitamin D that the body uses to make vitamin D. And vitamin D is related to our immune system, heart disease, all kind of health issues. They're finding now that a deficiency in vitamin D can lead to a whole ton of health issues. It's kind of what I wanted to say. If this was helpful, I invite you to comment below. So the essence of it, most disease and disorders and health issues are related to our lifestyle. So we just have to start eating healthily, get rid of the junk food, and start moving, get adequate sleep, drink plenty of water. This is some water with some watermelon in it. Plenty of water, cut out the junk, reduce your stress level, and take care of yourself and be consistent about it, because your health is indeed your wealth. Also remember, every system in our body is interconnected. The brain connected to the heart, connected to the lungs, connected to the kidneys, connected to the gastrointestinal tract, connected to the urinary tract, or skin. Everything is interconnected. So whatever affects the kidneys will affect the heart, will affect the lungs, will affect the digestive tract, will affect every part of our body. So that's why it is very important to get on board with the holistic lifestyle and stay on board. And if you mess up, just hit that reset button and reset, refocus, and restart, and start taking the best care of your body. All right? Take care, and God bless you now.